welcome to Season 2 of Inside the Therapy Room. I'm your host, Sam Sellers. I'm a registered therapist, a wife and a fur mama, and I am passionate about breaking down the barriers and stigma attached to therapy. I want to begin by first honouring the traditional custodians of the land we live and work on. Today, Jodie is on Gadigal land and Sam is on Gundungurra land. We pay our respects to the elders past, present and emerging, for they hold the memories, the traditions and cultures of our First Nations people. We must always remember that the land below our feet is, was and always will be Aboriginal land. You may notice that this season has more than the usual 10 episodes. That's because Inside the Therapy Room is finishing up. Sadly, the episode next week will be the last. But for today, I'm chatting to Jodie Gale. Jodie is the founder of TraumaWarriors.online, host of Soul Sessions with Jodie Gale podcast, and eco-psycho-spiritual registered clinical psychotherapist, complex trauma expert, mind-body eating, and plant-based nutrition coach. She is a leading specialist in women's emotional, psychological, and spiritual health and well-being. Over the last 20 years, Jodie has helped women to transform and heal their lives from complex trauma, emotional eating, and the trance of unworthiness. She has a private psychotherapy, counselling, and life coaching practice in Manly, Frenchs Forest, and Allumby on the northern beaches of Sydney, Australia. Jodie is passionate about helping women befriend, connect, and nourish their whole selves, body, feelings, mind, and soul. Today's episode is all about the world of eating disorders, and I guarantee it will not go in the direction that you think it will. We hope you enjoy joining us inside the therapy room. Welcome, Jodie. Thanks for joining me.
Hi, thanks for having me.
I'm excited about this conversation because I think it can spiral into something that it doesn't need to be in society and online and in people's opinions. And so you are here to talk about eating disorders, which tends to be, I would say, a relatively controversial topic in terms of where people stand on what an eating disorder is, where it comes from, all of those sort of big questions. So let's start with, what is an eating disorder?
Sure. So I think you're right by starting off with the controversy, because there are some pretty big splits in the field.
Yeah.
And you know, I asked you to send me through some questions before, and you've asked me what is an eating disorder and the different types. And I thought, well, if I answered from the medical model, I would definitely go into all of that. However, since my own recovery from bulimia, which I think we're going to talk about a little bit later, I really found getting help very difficult. I was in the UK at the time, and I went to the doctor and he said, oh, what is this? You know, because I was normal weight because I had bulimia. And he said, oh, you know, go away and come back in 6 weeks. And when I came back, he said, oh, so is this all sort of over now? You know, and this was like 94, 95, I reckon.
Yeah.
So, and to put that in context, that was around the time, I'm not sure how many years before that Princess Diana had come out and said she had bulimia. So I was kind of that generation that, oh, this is actually a problem.
Yeah.
Great way of losing weight. So my experience of medical model professionals was very negative. And then I found my own therapist for my own eating disorder, who was a psycho-spiritual psychotherapist, which was a very, very, very different approach. So for me, there's the DSM understanding of eating disorders, which is very criteria based. So even if you have everything else but this, you're not classed as having an eating disorder. Well, I fundamentally disagree with that, because there's here and then there's all the way across here, and you know, in terms of a continuum, you know, there's eating challenges, and then I would class dieting as an eating disorder.
Yes.
And as you know, even in our field, there are a lot of therapists who diet, who promote dieting, who support dieting. Well, in my opinion, they're supporting at very least disordered eating, but I would class it as an eating disorder. And then you go, all the way through to bulimia, binge eating, anorexia. So, excuse me, but for me, I take a holistic view. I mentioned psychospiritual view. So I trained in psychosynthesis psychotherapy, and we see that every symptom is a call to awaken to something deeper in ourselves. And what that means is that the eating disorder is kind of, when I try and describe it, even on my website, trying to get my niche correct, like an iceberg, the eating disorder's on the top, but underneath that is everything else. So I'd love to read a quote out, because I feel like I couldn't say it any better than this, and I actually used this at the start of my master thesis. So my master thesis was Call Off the Search, Eating Disorders, a Symptom of Psychospiritual Crisis. So in that call off the search, we're talking about the search for self. So here's the quote. This is by Normandy and Rourke, and it's from 1998. And at the heart of every eating disorder, whether it is compulsive eating, bulimia, or anorexia, there is a cry from the deepest part of our souls that must be heard. It is a cry to awaken, to embrace our whole selves. It is a cry to deepen our understanding of who we really are. It is a longing to know ourselves in mind, body, and spirit.
Oh, what a wonderful quote.
Yeah. That just to me is the heart of every eating disorder. Now, when you say what is an eating disorder, I guess, if we're in Australia, obviously, so we have the Medicare model, and this is something I'm on the psychotherapy leadership team with PACFA, and one of the conversations that we've been having is around how Americanized our counselling and psychotherapy has become. Medical model, insurance, Medicare, even like all the EAP, and you third party. Anytime you're working with a third party, there is a need to diagnose and to do whatever else. So, whereas I think 3 of us in the leadership team trained in Europe, where there's a very different, more creative vibe for counselling and psychotherapy. So I think in Australia, we're working very medical model with eating disorders. And a few years ago, maybe 4 or 5 years ago now, no, because that's the pandemic, so it would have been 1 or 2 years before that, I went to the biggest eating disorder conference in Australia, and I actually sat there and was triggered so badly back into my own eating disorder. I actually sat there and thought, I feel like stabbing myself in the head with my fork. I was eating lunch at the time, and I thought, if I have to hear one more presentation on CBT 123, CBTE, DBT, I mean, this was like acronym.
Oh, yeah.
Best or worst, whatever you want to call it. I thought, in this day and age, why are we still not talking about trauma? Which I will talk about later.
Yeah.
I've always felt that eating disorders were very creative ways of dealing with the underlying the iceberg, which is attachment issues, trauma, developmental trauma, complex trauma, and whatever else is going on under there. So, yeah.
Yeah, I think I even just tend to take the stance of, what we see is the quote unquote eating disorder, but what we don't see is the wound that it's come from.
Exactly.
And this is one of the reasons why I particularly was very, very particular about who I wanted to do this episode with, because I do know that it falls into the medical model far too easily and
Mhm,
into a diagnostic and a pathologizing sense where we just want to manage the behavior and the symptoms and not
mhm,
actually have a conversation about why they're there in the first place.
mhm.
And I think anybody who knows the way that I work knows that I am not CBT's number one fan.
Uh-huh.
But
No, that
yeah,
I
so
say that because you don't want
anytime,
to offend someone.
yeah,
Uh,
no, no, no. So anytime we have a real like cognitive approach, I go, we just miss so much of the
mm,
we just like, to use the iceberg analogy, we just miss so much of the iceberg.
exactly.
So before we get into the nitty-gritty, you've
Mm.
already sort of alluded to it, but what led you to specialize in this space?
Yeah, so I am a lived experience therapist. I guess we used to say I'm in recovery or I'm recovered, but I think it's June Alexander. She talks about lived experience, and a few years ago, I actually trained in Carolyn Costin eating disorder coaching. And there's two routes: there's lived experience, and then there's those who have never had an eating disorder. So I would class myself as lived experience. Yes, so look, I remember staring in the fridge at 3 or 4 years old,
Mm,
looking for something. And then I'd go to the pantry and then I'd go back to the fridge,
mm,
always looking for something. And through my own therapy, I came to realize that I was looking for love
yeah.
and soothing and, a history of domestic violence in the household, and then a very parental alienating divorce, a father who had 4 or 5 girlfriends at the same time. We were talking about cults earlier. I'm sure my
Mm,
dad has his own little cult of women going on there. This is back in the 70s. And I remember specifically one of my dad's girlfriends. She used to weigh us every week.
oh,
So I don't blame her for my eating disorder, but that was another level. And then she had 2 daughters who were always on diets as well. So we were all dieting. Dad was dieting. My mum worked for a figure clinic, she said, in the 70s in Surrey Hills. And she used to make jokes about, oh, they were all the fatties used to come in and I'd be there slim. And my mum was very beautiful. She used to have this chignon and, just very classic sort of Audrey Hepburn sort of looking, and she was always very slim.
mm,
And I used to eat cream cheese and Coke while everyone else was out there trying to lose weight. And
mm,
there's just a history in our family of dieting, talking about dieting, starting a diet every Monday, like my kids, when we go down to my dad's, which we're doing on Thursday. So we always have to prepare ourselves. I used to talk about the kids. When Poppy starts talking about dieting, what do we do? And
mm,
then they say, oh, just roll your eyes and say, oh, Poppy, we don't talk about dieting. And then,
yeah,
but my dad, he gets really, well, what the fuck am I supposed to talk about then? Because it's all he's ever talked about,
yeah.
and then of course there's a whole other layer of things that go along with that. So that is what brought me to, I guess, my teenage years, where I was a very distressed teenager.
Mm,
I think by the time of 8 years old, I was already covering up in my own pool when no one else was there. So I already had that level of body shame. And then by 13, I had bulimia. I
mm,
thought, this is great. I can binge eat and then spew it up again.
mm,
And then I don't ever have to put on weight. And I
yeah,
had no idea that it was anything but a diet until I mentioned earlier about she was Lady Diana then, came
mm,
on TV, and I kind of found myself in shock. Oh, that's like something bad. I
mm,
didn't know that. I mean, it was
yeah.
secretive, but I didn't even know that was bad in those days. I didn't know that that was shame and whatever else. Um, and so then I discovered drugs, amphetamines, and I was finally thin
Mm,
because I didn't have to. I call it my amphetamine-induced anorexia, because
yeah.
there's no other way on this planet that I was ever going to be thin.
Mm,
And then I found myself in therapy, mostly because I was living a very hedonistic lifestyle in London,
mm,
eating disorder, drugs, I used to smoke a packet of cigarettes a day, living on cherry Coke.
Mm.
And I actually went to Ireland and swam with fungi, the wild dolphin, and had a peak spiritual experience. And that really was the impetus for me getting help. I had an experience of a high that wasn't drug induced or eating disorder induced. And I thought, oh, I don't want to keep living my life like this. This is shit,
Mm.
like so bad. And that's how I found my therapist, who was also a lived experience eating disorder therapist.
Mm.
And luckily for me, she had a psycho-spiritual approach, and that she used to talk about Fungi the dolphin. Would he
Mm.
worry about what he eats? Does he worry about what he wears? And I'm like, are you kidding me? What kind of? Because I was like young and hip, and she was old.
Yeah.
That is so faggy. But I felt really seen and heard and loved for the first time. And then I realized, I came in one day and she had a little chart of subpersonalities, which has gone on to be used in internal family systems. And
Mhm.
there was a little sign saying victim, rebel, and the child, or the people pleaser, or something like that. So I'm looking at this piece of paper thinking, what the hell is that?
Mm.
And we started to, that's when I say, and then the real work began. It was nothing to do really with it was about the eating disorder, but it was about all of that stuff under the water.
Mm.
And I was with her, I saw her 3 times a week for the next 6 years
Yeah.
and recovered.
Amazing. And
Yeah,
I love when we talk about lived experience therapists, because what drives me insane is when you walk into the room of a therapist and they're deadpan and there's no emotion, and there is just, it's like, no, like, I'm a human and you're a human, and I want to connect with another human, not a robot. And
exactly.
that's important. Um,
I'm psychoanalytically trained as part of a psychospiritual psychotherapy. I don't think I've got it here because we're recording on video as well. I can't see it. I don't know where I put it. Anyway, my map of the egg diagram.
mm,
Um, so we work with the basement and the psychoanalysis. We work in the here and now, and then at the top we work with the transpersonal, spiritual, soul work, and all that kind of stuff.
mm,
Um, why was I saying that? Oh, yes. So I work quite traditionally at some
mm,
level, but in eating disorder therapy, we always use self-disclosure a little bit more. We're more directive sometimes. So I think you really need to, yeah, I think with lived experience, it's important that we don't go too down self-disclosure, but at the same time, it can be very useful in this kind of work, particularly with eating disorders. So.
yeah, absolutely. Okay. And so I didn't give you any warning of this question, so I apologize. But you've already mentioned it before, which is why I feel like it's okay. But what do we say that the difference is between, I guess, what would be considered an eating disorder and what is disordered eating?
Oh, look, all eating disorders are disordered eating, so
Mhm.
that would cover that. Look, to be honest, if we go back to the DSM, they would say there's very specific criteria.
Mhm.
I think within that, it's very limiting because, like I said, someone might have 5 out of the 6. Does that mean they don't have an eating disorder? I mean, come on.
Yeah.
And actually, going back to the Medicare, a few years ago, they gave people with eating disorders 40 Medicare sessions a year,
Hmm.
severe eating disorders. Well, part of me thinks, what does that actually mean? Because, if someone's severe and then they start to get better, do they then lose the Medicare benefit? I mean, I don't know. You'd have to interview someone who's a psychologist and giving Medicare. But I just found the whole thing kind of tricky.
Yeah.
So technically, if you pick up the DSM, it will have a very clear criteria of bulimia, binge eating, anorexia, and there's a few others. I think, it's because I never look at the DSM, I've forgotten what the name is, but it used to be called eating disorders not otherwise specified.
Hmm.
whatever that is. I guess that's your disordered
Very
eating.
vague.
Very vague. So, you've got your classic, if we're talking about your classic eating disorders, bulimia, binge eating, and anorexia.
Yeah.
And then, like I said, I mean, I spent probably 20 years dieting every Monday. Sometimes I'd last the day, sometimes I'd last 2 days.
Yeah.
Once I lasted 2 weeks, and then I ended up binging and then purging. So I would class all of those things eating disorders. But I want to say something about the word disorder. In an ideal world, I wouldn't call it an eating disorder.
Yeah.
I use that for my website SEO purposes. But again, a very creative way to deal with whatever it is that's going on underneath that. I don't, subscribe to that model. So, like I said, I've never picked up the DSM in my work ever.
Yeah. Yeah. No, I haven't, beyond when I had to pick it up for an assessment when I was first studying. And I don't actually even think I bought it. I think I tried to just get around buying
Google
it
it or
because I was
something.
like, I'm pretty sure I hate this before I've even opened it.
Yeah.
And I guess that probably is a good lead into what is the issue and the reason why classifying an eating disorder as a mental illness or a mental disorder, why is that so harmful?
Yeah, well, look, half or even more of the population of eating disorders therapists would say it's not harmful. They subscribe to it. So I think it's a matter of opinion.
Yeah.
And I think it's a matter of who is talking about the opinion. So for me, mental disorder, mental illness, firstly, if we go back to that quote at the beginning, for me, eating disorders are about body, feelings, mind, and soul, not just the mind and our thoughts. And that's where treatment has been focused, on mind and the thoughts. We've started to, over the last 10 years, bring in somatic therapy. I mean, I started training in 99. We had a module of somatic therapy back in 99. I was very lucky in my training. It was a very holistic training. So we didn't go into full-on somatic training, but we at least had an experience of what that was. And also, the therapy I trained in, we did mindfulness and all those kind of things. So we've always looked at, we didn't use the word trauma back then. We called it early childhood wounding. But we've always looked at those other elements that underlie the presenting symptoms. So you could say that those symptoms present as an illness, mental illness, but for me, it's about what's going on underneath. So focusing on that holistic model of care, not that medical model where people are reduced to the diagnosis.
Yeah.
I feel that diagnosis puts a glass ceiling on recovery. That's ultimately why I don't follow that model. Also, because for myself, I just don't subscribe to that for my own. I think I wasn't mentally ill.
Yeah.
I was traumatized.
Yeah. Yeah.
So and not that there's any shame in mental, if you do subscribe to that model, that is fine. If that's the way you want to go, that is fine. For me personally, and for the people that I only work with women these days, it's because I work from a home office and a marketing. It's much easier to speak to one person. But the women I work with, they come to me because they have been through that revolving door so many bloody times. And also this American model of the insurance-based and whatever else that we're doing here in Australia, you get your 10 or now you get 40 if you've got severe eating disorders, which most of the people who come to me, if they did, I would send them off to a treatment centre. So if someone came to me with anorexia and I thought they were going to die if they keep doing what they're doing, I would send them off to a treatment centre and start working with them afterwards. Go and do all your mental illness, mental disorder stuff there, recover, start eating, and then let's start the real work. I mean, that's not real work. People need to eat. So, and have enough cognitive ability to do the work. So I'm not denying that, but most people who come to me have been through this 10 sessions of Medicare where they spread it throughout the year. It's nowhere near enough. If we're talking about attachment disorders, really.
Yeah.
If someone's coming once every second week or once every third week, I describe it like the strange situation where the baby's left on the floor, the mother leaves the room, and she just never comes back. So for me, therapy is always really consistent because people with eating disorders, there hasn't been consistency.
Yeah.
And if you think about particularly bulimia, I think is the most disorganized actually in terms of attachment. It's all over the place. It's chaotic. I'm not going to repeat chaotic booking system with a client who needs security and stability.
Yeah.
And so I don't like that model, like even going to a psychologist for your 6 to 10 sessions and spreading them out over the year, and then, they've run out, so now I'll wait till next year.
Yeah.
I mean, the whole thing is re-traumatizing, in my opinion. I mean, I'm sure people recover, but I do get people who have been in and out of this mental illness Medicare system for many, many years. Revolving door syndrome, we call it.
Yeah. And I think I often think when I guess when I sort of equate eating disorders to that mental health medical model, I sort of go, I find it dehumanizing almost because it just reduces someone to a cluster of symptoms. When that cluster of symptoms could actually mean, if we sort of shift to like a physical thought, a cluster of symptoms could mean anything from, migraines to a brain tumor or a bleed on the brain or something like that. And so, whilst ever we just look at the cluster of symptoms, we are missing the heart of the actual issue.
Absolutely.
And I think, we have this picture in our head of what an eating disorder looks like, and it obviously is fueled by the media as well, which is,
yes,
this
it's
very
much more
thin,
complex.
emaciated person, which is not the case.
Yeah.
And
Eating disorders are complex. They are made up of hundreds of things sometimes. So actually, one thing I want to say about mental illness as well, and this is you'll see will be a theme in my work, is that it's placed the problem is placed on the individual and their mental illness. It's very convenient. I won't say who for right now, but it's makes things very easy at some level because we've got someone to focus on, something to focus on, and we focus all on that, and then no one else has to look at what's going on around them. And society, family, all that kind of stuff. That's all being, look, people are talking more about society, but it's, you're still, what will I say about this? I have been hounded down by parenting groups and attacked online for suggesting that trauma underlies eating disorders. So a lot of therapists tiptoe around parents, eating disorder professionals, especially underage kids, because they know the kid needs help and they know they can't alienate the parent. And so they don't say anything. I've had people email me from my Instagram page, message me and say, I've been in rehab or treatment centres 10 times. No one has ever mentioned trauma to me. She said, your post has changed my life. Like this is, I cannot believe what I am reading here. So whether that's changed, and I haven't had anyone from a treatment who's been in a treatment centre lately, probably 2020, first year of the pandemic was the last time I had someone. that was more really just refeeding and whatever else. But yeah, so it also takes away from the real problem, in my opinion.
Yeah. Yeah, absolutely. And so the podcast is called Inside the Therapy Room. So
Mm,
what does, therapy look like for somebody who comes to you with, I guess, what is presenting as an eating disorder?
mm. So yeah, look, if someone's really, really sick, and that does tend to be anorexia.
Mm,
Look, these days I don't really work with anorexia anymore. I've been in practice for 22 years.
mm,
You probably know because you're in my Facebook group that I had a bit of an existential crisis in the pandemic where I decided I could no longer
yeah.
see as many clients a week as what I used to.
Mm,
But so I really now see people with emotional eating, even people presenting with bulimia, I probably don't see as much. Usually people, I'll tell you who I get, people who have been in therapy for and have recovered,
mm,
inverted commas, um, and then realize, oh, I have all this other stuff going on. Like my eating, I've stopped
yeah.
binging or I've stopped purging.
Yeah.
I've started eating, but I'm still sick in some way.
Yeah, the behavior has stopped, but the emotion is still there.
So that's who I tend to get. So, what it looks like in therapy is, like I mentioned, I trained in psychosynthesis, psychospiritual psychotherapy. And so it's a long term depth psychotherapy. And so, even from the onset, much to some people's dismay, I only take people who will come weekly.
Mhm.
And even when clients, I had someone recently ask, why do I have to come weekly? You haven't even met me yet.
Mm,
Um, it's a good question because I go back to the strange situation. And I think, especially with people who have had disordered eating, I know that there is probably a narcissistic wound where they haven't been seen and heard. There hasn't been space for them. It's been all about someone else.
mm,
And I am making a space for you every single week. If we talk, I've got my hands up here doing the circle of security, safe haven, secure base, that every week you will go out into the world and then you will come back in to have your cup filled up. You will be nourished every week until you have the capacity to do that for yourself.
yeah.
And what I include in the work is I've worked with parts, work subpersonalities, which is um, the notion of the self, and the subpersonalities is the basis for internal family systems. Um, and how I work with people is to start to get them more and more and more towards becoming we don't say blended. I don't like that term. I think it's incorrect, but we say identified. So they are either identified with their core healthy soul self,
Mhm.
or they are identified with one of their parts. So
Yeah.
when someone comes for eating disorder treatment, if we just have a group subpersonality called the eating disorder self, they are more identified with an eating disorder self
Yeah.
than they are and they might have even stopped the behaviors, but they've still got all these subpersonalities that are still acting out eating disorder behaviors, such as so when we work with parts in psychosynthesis, we've got the behavior and even body posture, the way we dress, and then we've got the thoughts, and then we've got the feelings, and then we've got the quality or the self that is seeking to emerge out of this subpersonality. So what's really going on? What's the need? And then what's going on at the core? So things like, the victim subpersonality. Now, a lot of people don't like that term. It's got a bit of an 80s rehab term. But I know I spent most of my life in angry victim. And then every time I got angry and felt victimized, I went and ate.
Yeah.
I'd stand at the fridge doing fuck you
Mm,
to whoever it was that had pissed me off that day. And
mhm.
then, what do they say? Eating poison and expecting the other person to die.
Yes. Yeah.
That's exactly what the angry victim does.
Mm,
Now, she was a victim.
mm,
So in therapy, we go then inside the therapy room, we go then and find out, what were you a victim to? It's a compassionate stance. It's not a, oh, you're a victim, get over it. It's a compassionate stance. Like, I was a victim. I was a victim to trauma, domestic violence, parental alienation. Like, there were narcissistic parents, you know.
It's also a validating stance.
Absolutely.
Yeah.
Absolutely. Look, I think 80s rehab was a bit aggressive with it, but
Yeah.
if we're talking about certainly subpersonality work, and I know that IFS works in a very similar way. And then, you know, you'll have the judge, the inner judge. You're fat, you're disgusting. No wonder you haven't got a boyfriend, whatever it is. You know, you're not good enough. You're not enough, all that kind of stuff. So we work with that. And one of the others I always talk about this part. I don't know how old you are. You might be a bit younger than me, but did you ever watch Desperate Housewives?
Oh, yeah. Yeah.
You know, Brie Vanderkamp.
Mm-hmm.
My colour needs doing at the moment, but my hair colour is normally very Brie. My friends call me Brie, and that's because if you came to a dinner party at my house, it would be the best dinner party you've ever been to, because I've spent 5 days driving all around Sydney looking for exactly the right ingredients. I've done research for the recipes. I'm a vegetarian. I've been a vegetarian since I was 23 years old. I just turned 53 on Sunday. So what's that, 30 years? And my way of trying to get people to become vegetarian was to cook beautiful vegetarian food. But one day my friend Tina said to me, you know, Jodie, I was driving down the M3, and this is in London, and she said she's an eating disorder therapist too, and also lived experience. And she said, and I found myself not thinking about coming to see you, but thinking about your food.
Oh.
And that was like 20 years ago or something, when we were training in psychotherapy. And then I realized it was all about trying to please people, trying to think I was unlovable, but they'll love me if I provide good food for them. And so there's this facade of this perfect Brie life going on, but this utter chaos going on inside. So in the therapy room, I'd work with Brie. Tell me about her.
Yeah.
No? And there's a really great clip. I don't know if you want to put it in the show notes, where she has the birthday cake. I think it's for Danielle, the daughter, and the cake's perfect. And then she goes to the kitchen for the knife and comes back, and someone swiped the cake with their finger. you can imagine her.
Oh boy.
And then, of course, she goes to the fat girl and says, "It was you, wasn't it?"
Yes. Yeah.
It wasn't her, it was either the daughter or someone thin, actually. But these are all the different parts we work with. And we're on video here, so you can probably see my shelves there. I've got lots of little knickknacks around the room and lots of toys, and people can use anything they want for their parts work. I've got a little stuffed teddy there that I hold and soothe. And some people are like, why are you doing that? That is weird. And I'm like, I'm just soothing the baby. And for some people, that's like, I don't even know what that means.
Yeah.
So you're soothing people. And basically what I'm doing there is recovering the split off parts to bring the person back to their whole self. And we might use dream work, visualization. I'm with my own therapist, and I won't talk about other clients, but this is what I would do. Taking someone into the basement, recovering. I remember there was a part in the basement that was starving and hiding behind boxes, and my therapist took me in, picked her up, or started to communicate with her. She didn't want anything to do with me, actually. And then my therapist said to me, just leave the basement door open and see what happens this week. And I was like, no fucking way. I'm not leaving the door open for that thing down there.
Yeah.
Parts. And with an eating disorder, you loathe yourself. I felt like I was a rotten apple at the core. That is all I thought I was. And this part represented that. And so then about 3 days after my therapy session, this part was sitting on the top step, and I'm like, go away, I don't want you up here.
This is inching closer.
Closer. But by the time I went back to therapy that week, it was sitting at the bloody dinner table eating.
Yeah.
And So what we're talking about then is leaving the door open to start to connect to these very split off, deeply wounded parts and bring them back in and take care of them. And, I might say to people, knock, 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 who's at the door? And the person will say depression. And I'll say, and then what do you say to them? Go away, they say, which is very CBT. You're trying to get rid of depression. What I say is, well, hang on a minute. How about we open the door and let them in? Why would I do that?
Yeah.
Let's invite them in. Do they want to lie down? Do they want a cup of tea? If you had a depressed friend, would you tell them to go away? No. How do you think they feel when you tell them to go away? Oh, more depressed. I went, exactly.
Yeah.
So how about we welcome this part in? And I guess Dick Schwartz is very smart in the book No Bad Parts. It's the perfect name for this work, So, and of course, then other things like resourcing them with nature therapy and doing all those sort of things. But for me, even using subpersonalities, and this is my problem with IFS, it's become this big guru-y thing.
Yeah.
For me, the ultimate way to work with someone with an eating disorder is to be in relationship with them. And it's about the therapeutic relationship. Everything else is just periphery, really, in my opinion. It's about loving this client to bits. And because they have likely come from a narcissistic family system, said it, it's about them being seen, heard, validated, loved, cared for, and then over time they start to build that healthy, loving mother, healthy boundaried father, so mother, masculine, feminine energy, and they internalize that and they can start to take care of themselves in that way. But I believe you still need a therapist. I think parts work is great, but you still need the therapist to model and mirror self.
Yeah.
Because this person is so far removed from that healthy self.
Yeah, and I think the modeling is the kicker, because I think you can read all of the incredible books that you like, but whilst ever you're reading, you're still all up here in your head, still all up here.
Exactly.
And you don't heal trauma. People will hate what I'm about to say, but CBT does not heal trauma. It just doesn't. Your trauma is not in your brain. Your trauma is in your body. And so to be able to see and witness somebody else modeling the things that you need is a core part of that. That's not
Absolutely.
a cognitive thing that's
And
happening.
look, CBT is useful, and it's interesting because I remember going for a job once, and they said, "Oh, we can't employ you because you don't have CBT." So I went and did a CBT course, and I thought, "Oh, this is CBT. This is what I do when I work with people's thoughts."
Yeah.
Back when I trained, there wasn't all this emphasis on all these different acronym sort of things. It was all weaved into a depth psychotherapy training, so I didn't even know I was doing CBT. It is useful for working with people's thoughts. Like, if we go back to thinking about the judge, where did this thought come from? Who did you learn this from?
Yeah.
It's useful, but it is not a whole complete therapy. It's one little technique, like subpersonalities, IFS, EMDR, whatever it is a little technique that people have made big. It is a little technique to help you as part of your toolbox. The relationship with the client is always going to be the healing factor, in my opinion. And that's 22 years working with clients, lots of clients. So.
Absolutely. And so you've sort of touched on this a couple of times, but I see this a lot because it's probably just part of who I follow on social media. So it is in my face.
Yep.
And so for a lot of people who are not thin, who don't have thin privilege, that term, to seek and get help for disordered eating or eating disorder or whatever
Mm.
terminology you want to use is incredibly difficult and almost discriminatory, because
Absolutely.
you can't have an eating disorder, you're too fat,
Yes.
essentially.
Yeah, yeah,
Yeah.
yeah.
And so what role does, diet culture and fat phobia and all of that play in
Mm.
terms of people seeking help for this?
Yeah, look, I just think it's very difficult to get good treatment regardless
Yeah.
of your size.
Mm-hmm.
And look, I know there's some eating, I guess that's where I'm going with this. A lot of eating disorder groups, well, it's not eating disorder groups, but some people would say, well, at least people in thin privilege get treatment, and people who are thin, like someone with anorexia, is going to be very noticeable in their eating disorder.
Yeah.
Someone in a fat body, now there's two things going on there. A, they might be fat.
Mm-hmm.
B, they might also binge eat.
Mm.
So we can't just say, don't sort of treat this person, give this person a diet and treat them in that way, because what happens if you're fat and you go to the doctor, they give you a diet,
Mm-hmm.
which contributes, which they're giving you an eating disorder, in
Yeah,
my.
absolutely.
So they're not working with health at every size. They're not working. And look, I'm a very good example of this. I've got type 2 diabetes. So my doctor kept saying, lose weight, lose weight, lose weight, lose weight. I
Mm.
got Invisalign and I accidentally lost weight, because you have to have them in your bloody mouth for 22 hours.
Mm.
And my sugar went up,
Mm.
not down. And she said, well, I can't understand what's going on here. And I said, well, I've stopped snacking on hummus, nuts, like all my protein foods were my
Yeah.
snacks.
Yeah.
So I'd lost weight because I wasn't eating, and a lot of weight.
Mm.
Not because I wasn't eating as much, but my blood sugar was higher than it had ever been. She said, go back to doing what you were doing before. Like,
Yeah.
it's okay to put the weight back on. That actually isn't the issue. And, you're going to get lots of people listening to this thinking, oh, this is bullshit.
Yeah, that's
So
okay.
I have an episode on my podcast about, it's with Alison, and it's probably the third, fourth, fifth last podcast about why therapists should not support intentional weight loss. And this
Yeah.
is why, because we end up binging,
Mm-hmm.
end up with more disordered eating. So I think good treatment, I think you can get any kind of treatment,
Mm.
but good treatment is actually difficult for everyone to find who struggles with food issues. Even people who diet,
Mm.
no one is telling them that this is disordered eating, you know? So fat people are typically the people who have been on more diets than anyone else on the planet.
Mm-hmm.
We're called lazy, this, that. Actually, going on a diet every year for 30 years is not lazy. The
No,
amount of effort this
it's
takes is
it's so
unbelievable.
much effort.
The
Yeah.
amount of thinking it takes, getting ready for the gym again, and then you go to the gym and you think, I'm too fat, I'm too embarrassed, I don't want people to see me, so I'm not going to go.
Mm-hmm.
This is not about willpower or all those kind of things. So yeah, I think it's difficult for all people, but I think doctors in general only see when people get too thin.
Mm-hmm.
And like I said, with my eating disorder, it was missed for
Mm.
7, 8, 9 years before I actually, well, no longer, because I was 13 proper. It was before that, really, but 13 proper till I was 25. So that's longer. That
Yeah.
12 years it went unseen. Bulimia, very hidden,
Mm.
because I was normal weight.
Yeah.
So I think this is a lot bigger than all that, but
Yeah.
I think good treatment is hard to find in general.
Yeah. And so, what would you say to therapists who are working in this space? What message would you have for them?
There are plenty of therapists
Yeah.
who are disordered eating,
Mm.
and myself included. Sometimes, I've been recovered from bulimia for what was I, 25, and I'm 53, so a very long time. Sometimes over those years, I have been tricked back into dieting,
Mm-hmm.
because of something. I mean, look, I recovered I remember being recovered, early recovery, doing really well, and then working in an office with 70 women who were all doing drugs, and who it was the Atkins diet days, the first protein diet. And I used to have a bagel with cream cheese or mushroom pate, and then cucumber on top every day. I had the same thing. And then one day someone said to me, how do you stay so slim eating a bagel every day? Well, the next day there I was at Weight Watchers thinking, oh, I better stop eating bagels. I was very early in recovery. And it's very hard to maintain your stance when the whole world, especially at the moment, are carbophobes. And so what happens is, I remember, because when I got my diabetes and the doctor's saying you need to lose weight, I'm thinking, oh, maybe I do, maybe I do. I was following Health at Every Size, but I thought, oh, she's telling me I need to. So I went into Big W and I picked up an 800 calorie a day diabetes book. Well, guess where I went next? The Donut Dan straight outside the Big W.
Oh,
Even the thought of restricting is enough to soothe myself with donut. I mean, that was a long time ago now. I was 44 at the time. But therapists, and I notice if I say to people, what did you have for breakfast today? You can see it. There is no carbohydrate on the breakfast.
Yeah.
Because therapists are following this delusional idea that we shouldn't be eating carbohydrates. It's bullshit.
Yeah, absolutely.
Even the biggest mastering diabetes, even they say you can eat carbohydrates, and they say bananas, dates, oats. It's just crazy. So I think therapists need to take a really good look at how they are disordered eating themselves.
Yeah.
How they are trapped in diet culture. Any therapist on paleo, all that kind of stuff, that is disordered eating, because you are not listening to your actual body. You're following an external person telling you what to eat.
Yeah.
Now, that is never going to work.
Yep.
And then they support clients to do the same, and that is dangerous, in my opinion.
Yeah, absolutely. And I would add a caveat, because I've seen it come up in my room so often, even just in the last couple of weeks, but it tends to come up. I don't know whether you see the same thing, but themes come in waves, I feel like, in the room. And I'm currently in a wave of having a conversation with many people around, can we just remove the moral value around food?
Exactly.
And I think that as soon as a therapist starts using good, bad, healthy, unhealthy, anything that would attribute a moral value to food, you are automatically having the wrong conversation.
Oh, absolutely. And what we know is that the word healthy is so loaded.
Yeah,
It's
exactly.
dieting to a lot of people.
Yes,
It's
absolutely.
so distorted that to be healthy means, I'm only clean eating. So if you're clean eating, you're on any of those plans, you are not intuitive eating, you're not listening to your body, you're listening to something else that someone else has said. And the other thing I want to say there is also get some Health at Every Size training. Read up, listen to some audio books, podcasts, whatever else. And I want to be very clear with that, it doesn't mean that everyone is healthy at every size. Someone with anorexia is thin, but they're not healthy. Someone with bulimia might be normal in the middle. I say normal in the normal category. In what do you call that? Awful.
Oh, the stupid BMI.
Normal BMI. That's what I'm talking about. Notice we both said,
yeah, that could be also a whole podcast.
Exactly. But they're not healthy.
Yeah.
I was a normal weight. I was really binging and purging up to 30 times a day, smoking a packet of cigarettes a day, and living on cherry Coke and amphetamines. Like, that is not healthy, but I was a normal BMI.
Yeah.
So, but what Health at Every Size means is we always focus on their health, not their size.
And I think that that's a really good distinction to make, because I think people do just take that and they run with however they view that phrase, and
Yeah.
it's not always correct.
And I think for clients as well, because there
Yeah.
are a lot of people spouting health at every size, sitting there shoving donuts in their mouth. Now, a donut, even one donut a day is not a problem.
Mm.
But if you're sitting there binging on donuts and saying health at every size, like
Mm.
that's actually not okay either, because
Yeah.
we know that, that we're starting to, anyway, it's another form of disordered eating, in my opinion.
Yeah.
So,
Yeah, absolutely.
yeah.
Okay, so this is often my favorite part of every episode, which is, what myth do you want to smash? Because I would imagine the list is endless for you.
Oh, look, it
But
is. And I couldn't think of what the actual myth was, but I guess what I wanted to say is just take, for example, World Eating Disorder Day,
mm,
the biggest kind of eating disorder day on the planet, is run by parents.
mhm.
Now, I find that very problematic.
Yep.
And I have been inside that group. And so the myth that I want to bust is around that eating disorders can start and thrive in narcissistic family systems.
Mm,
There's the mental illness model, and then there's the gene model.
mhm.
And there's a brain-based model. There's all these models that people take other than narcissistic family systems. And so Carolyn Costin would say that genes load the gun. It's
Mm,
the environment that pulls the trigger.
yeah.
So we're talking about social environment, when we're talking about that stuff that we were just talking about, we're talking about, the culture. And of course, family members have been indoctrinated by the culture and all that kind of stuff. So, and transgenerational trauma.
Mm,
So I'm not saying that every family has this problem or that every eating disorder starts here. I just want to put
mm,
that out there. However, in 22 years as a therapist, I have never worked with anyone who didn't come from a narcissistic family system, ever.
mm, yeah.
And what that means is that when we're talking about narcissism, from a psychosynthesis perspective, we're talking about a wound,
Mm,
a trauma wound, where the person has not been seen or heard. They're arrested development. I always think of that band, arrested development. The self has been arrested.
yeah.
Okay. There's been attachment issues, anxiety. And when we think about it, people say anxiety, anxiety, anxiety. Well, what is anxiety? It's an attachment issue.
Yeah.
It's I don't feel safe and secure in the world.
Mm,
And so for me, the one or the other or both parents' needs have been primary to the child's
mm,
feelings and needs, feelings and needs, feelings and needs.
yeah.
So have you read I'm Glad My Mum Died?
Oh, no, but it is on my list.
It's so good. I haven't finished it, so I can't say how it ends, although I'm assuming the mum died.
Yeah.
This is the ultimate, I think, for anyone suffering with an eating disorder,
Mm.
read or listen to the audio, actually, because the author was an actor. So she was in iCarly. I don't know
Oh,
this person
yeah.
because it's not my generation, but she was a very famous actor. And but it's interesting. I've just read the bit where she said she's about to tell the mum, "I want to give up acting. I want to write." And
Mm,
so she starts to tell the mum, and the mum starts losing it because
mm,
the mum wanted to be an actor, and she was a failed actor. So her whole life is lived through this kid.
mm.
I mean, this is the extreme end, although I think every one of my clients, if they listen to this book, would not find it extreme.
No, yeah.
And the whole book is about the narcissistic mother. Now, I'm not blaming mums. It can be mum, dad, whoever. And it's a transgenerational trauma. The mother had a mother, who was behaving like this.
Mm-hmm.
That they were never seen or heard for who they truly are, and they had to be someone else.
Yeah.
And so I get a lot of stick for that, even in my therapist Facebook group, because therapists have kids with eating disorders. Imagine that.
Yeah.
Um,
But I think it's not about blaming, it's about understanding.
where it
And I
comes
think when you understand where something comes from, it's not just about knowing how to navigate healing that part of
from.
you, but it's also about validation,
Oh, absolutely.
and I find when, even in clients that have had religious abuse, when we call it abuse, not, harmful behavior, that's really validating
Mm.
because, and so I think sometimes we need to, I mean, I think sometimes we just need to take the ego out of a lot of things, but it's not about the parent, it's about understanding where that wound is coming from
Well,
and
the
not
parent
about
is wounded.
blaming them. Yeah, exactly.
But the problem
Yeah.
with narcissism, and we're not, let's differentiate here. We're not talking about narcissistic personality disorder. We are talking
Yeah.
about a narcissistic wound where the person drops, and I talk about, we studied the narcissism, the poem with Narcissus, and we did narcissism for a full year in my psychotherapy training.
Mm,
Part of that weaved in with other psychoanalytic subjects. So what we're talking about here is echo and narcissus.
mm,
And echo is the deflated sense of self. Narcissus is the inflated sense of self.
mhm,
Now, there's somewhere in the middle that this person can't access, and that's the self, the healthy self-esteem. And so what happens is, especially with eating disorders, addiction, what we would say is someone with an eating disorder is actually a narcissist at some level,
mm,
because I remember walking down the street, looking at myself in every shop window.
mm,
Oh, I'm fat, I'm disgusting, me, it's all about me. And I'm
mm,
like Echo, the nymph in the cave, thinking I'm bad, I'm no good. And then there's Narcissus, everyone else over there who's walking around, they're so great.
mm,
And so you're swinging between this. And then I go to one of my better than, especially once I became a therapist with my family, I thought, what do you not know? I'm a
yeah.
therapist. I know everything. And so it's
Mhm,
swinging from this low, deflated sense of self to an inflated sense of self to help buffer myself up.
mm,
And that's exactly what's happening in families. So it's really tricky. I do parent coaching for eating disorders. It is really tricky work because
yeah.
um, people with a narcissistic wound will be in one of these positions. I'm
Mm,
a terrible mom. It's all my fault. Well, it's not my fault. It's a gene problem or it's a mental illness so there's a lot of denial there from parents. People who recover the best have parents who say, oh, shit. Oh, yeah, I
mm,
have this wound too. Oh,
yeah.
Jesus, I think I better go get some therapy to work through that.
Mm,
Yeah, the ultimate in narcissistic mothering, there's a book called Brave Girl Eating. And for me, the whole book is about the mother,
yeah.
not the daughter. I mean,
Mm,
what does that tell you?
yeah.
That's exactly what's going on in the family system.
Mm,
But, we're talking about here
yeah.
a family that is wounded.
Mm,
And actually, this is the myth, an eating disorder is not an individual disorder. It is a family
mm,
and societal disorder.
yeah. Yeah.
It is
Absolutely.
not. You can keep sending your kid off for treatment somewhere.
Mm,
That's the wrong route, in my opinion. Look, that's one part of it,
mhm,
but don't send her off somewhere where she's going to be pathologized and made the problem.
mm,
The best recovery is when the whole family take action with their own wounding,
mm.
focusing on the child, not just focusing on the child's.
Yeah, absolutely. I think that is a wonderful place to end.
Yep.
Nice food for thought, ironically, for parents out there. But thank you. I think it is an ever-growing conversation that needs to happen.
Mm-hmm.
And like I said, I was really particular about the fact that I did not want to have this conversation with someone
Mm-hmm.
who was going to go at it from a medical, very clinical diagnostic point of view.
Mm-hmm. Apart from anything
Because
else, it's so boring.
yes, exactly.
This
And
is so much juicier.
yeah, absolutely. And I just think it's That's just not a productive conversation to have in my book. And it's not a helpful conversation for people who work in this space and those who are seeking help in this space.
I
So,
agree. There's
yeah.
just one other thing I quickly want to add about myths.
Mm.
There's another myth with therapists that you shouldn't love your patients,
Oh,
clients.
yeah.
I just think this is the biggest bullshit. I don't know who's teaching this stuff.
Yeah.
Because one of my psychoanalytic trainers, Jarlath Benson, he wrote the book Working More Creatively with Groups. It used to be recommended in quite a lot of therapy trainings. He was amazing. And he said every wound is centered around love.
Mm.
A lack of love, wanting to be loved, wanting to know that my love is received as love. Like, you think of children, it's,
Yeah.
and so if there's been a lack somewhere, how the hell are these people going to know how to feel loved if we don't love them?
Mm-hmm.
And so for me, when I take a client, I am always thinking sometimes I have to learn how to love
Mm-hmm.
clients, but and actually in psychosynthesis, we have a model called bifocal vision, where there's the ego and the personality and the annoying things people do. And then there's the soul and spirit of the person, the essence of the person. So we always love the essence of the person while we help them sort out those other annoying sort of things.
Yeah.
And that's like children too. When you raise kids, you're like thinking, this behavior is really bloody irritating, but I still love the soul and spirit of who you are.
Mm-hmm.
It's exactly the same with clients. And I think that's a myth that having this cold, when I think of even like DSM, eating disorder treatment, I bet you any money these people don't know how to love these clients. Like,
Yeah.
they're repeating the eating disorder by restricting
Mm-hmm.
love and relationship.
Mm-hmm.
So they're just doing what's already been done to them at some level. So we
Yeah.
must love our patients.
Mm.
And
Absolutely.
if you can't, then I would question about whether you need to refer the client on to someone who can love them. I mean,
Mm-hmm.
you might do
And then
okay.
go and do your own work.
Go and do your own work. Well,
Yes.
long term, and this is the other thing, being in long term depth psychotherapy where you have an experience of being loved by the therapist
Yeah.
and dependent on your therapist, so you can work through all your own dependency issues. And people say you shouldn't encourage dependence. Well, it's not about encouraging it, but these people have never had anyone to depend on. They depend on food
Mm-hmm.
or starving themselves. So of
Yeah.
course it's better that they depend on us,
Mm-hmm.
and gradually we help them not depend on us, and then off they go out into the world, like the circle of security, off to explore. And then
Yeah.
can have your cup filled up, and then one day you won't need me to have your cup filled up. You'll
Mm.
have your own things going on in your life outside the world.
Yeah. Absolutely. I'm glad you mentioned that because I think that's an even better place to land at the end.
Yeah.
Because I think yeah, I wholeheartedly agree on that topic. So yes. So thank you. Thanks for
Thank you for
joining
having
me.
me.
It's
I know
been
when you reached out, you said you're not really taking clients anymore. I do feel, one of my the reasons I'm not taking clients anymore is because I've started my Trauma Warriors website,
Yes.
where I do want to keep working with people with eating disorders and trauma in a different way. I'm reaching the end of my capacity for one-to-one work. I have
Yeah.
I have 6 clients at the moment, small practice.
Mhm.
Um, where I see that I would really love to take this to a bigger audience, and for people who maybe can't afford therapy,
Mm.
people who can't have access to therapy. So really working towards providing some online offerings there for that. So so even though you reached out with that sort of context,
Yeah.
I do feel it's important to talk about a different way of working with eating disorders, because there is too much of the acronym stuff going on.
Absolutely. Yeah, I wholeheartedly agree.
So thank you for having me.
Thank you. We hope you enjoyed joining us inside the therapy room. Thanks for listening.